Today we're answering questions from realself.com, and the question here today is what to do with bald patch after facelift. She goes on to say that I have a bald patch above my ear and slightly in front of each. It's like the sideburn is higher and almost gone. I had a very weak hairline before my facelift. The other side is fine. What can be done to rectify this? When I was training back in the early 90s, I observed surgeons who did facelifts very aggressively, where they would pull this part of the skin upward and it moved the hairline up. And essentially, in my opinion, it doesn't make someone necessarily look youthful, because it makes their hairline recede further, which is an aged appearance. But that's a stylistic difference in terms of facelifting. When such a situation occurs as it has for you, I routinely actually do hair transplant. And what that means is we take hair from a permanent donor zone, or a zone that's part of the scalp, where even whether it's male or female pattern hair loss, if that's your natural history, there's still a part in the back of the scalp that tends not to ever be lost. So we take that hair that would not be shed ever in your life and under a microscope make individual follicles that we transplant at an angle to restore the appearance of a normal sideburn. So that procedure is done in our facility in a Joint Commission certified operating facility under local anesthesia with sedation. The thing to understand also about hair transplant is that when you look at the density of your own hair in other areas, you notice the hairs are very close together. And when you do a hair transplant, we can only bring so many hairs close together, and you may need more than one session in order to be able to get the result you want. But it is a common problem or a common concern, and we do frequently use that approach, is to do a hair transplant. I think it's the most practical and predictable, and it restores a lot of our patients their confidence in looking a certain way. For women in particular, hair loss in this area is very unsettling, and to me it makes a big difference to have the hair there. It just balances the face, and I say to my patients that hair frames the face. And in our practice in terms of facelifting, I rarely do that approach to where the sideburns end up going so high. There are ways to elevate parts of the face in a more segmented way that can still look very, very good. So I think this is just a stylistic difference, but certainly there is hope for you, regardless of the degree of scarring. We've been very impressed with the resilience of hair. We've done patients who have had burns as well as other kinds of injuries and placed hairs in something that looked like didn't have any blood supply, and the hairs grew. And so to answer your question, hair transplant would be my typical approach to treating your situation.